Okay. Hey, everybody. How's it going today? Happy Tuesday. I am your host, Dr. Katie McCalley. I am a chiropractor in Colorado Springs at High Altitude Chiropractic. So I am just getting everything set up on my end. If you are watching live and you have questions, feel free to put those questions in the chat. I'm going to be keeping an eye on that. If you are watching a recording, please comment on the post or the social media or reach out directly to me if you do have any questions. So again, I am Dr. Katie McCalley. Thank you guys for joining me, whether you are live or joining after the fact for the recording. So today we are going to talk about carpal tunnel syndrome or wrist pain and dysfunction. This is a big one. Before we get started, I want to let you know this is our last weekly wellness webinar in this format. So what I've been doing a lot of research about what's going to best meet the needs of people who are watching and tuning in. And what I'm going to try to do is take most of these topics and put them into little bite-sized videos. So a couple-minute video on social media is the direction we're aiming for. And then probably do once every month or every couple of months, maybe do a longer one like this. But I think that if we do the shorter ones, we can get little bits of information out there to people a little bit more effectively, because some people just don't have 30 minutes to sit down and watch the webinars we do. So, and I want this, the reason I do this is to get information out there. So that is why I do these webinars. If I just genuinely believe that people are trying to do the best they can do, and there's just not enough information out there. So that's why I do this. If you are wanting to continue to check out our, they're not going to be really webinars anymore, because they're going to be smaller, shorter videos, shorter bite-sized pieces that we can digest a little bit more easily. Keep an eye out on our social media. So you're going to find that on Facebook at High Altitude Chiropractic. That's our Facebook page. And on Instagram, High Altitude Chiro _CS. That is our social media. That's our social media handles. We are also posting everything on YouTube, and I will continue to do that with the shorter videos too. That is, the YouTube channel is High Altitude Chiropractic. So we are just trying to figure this out to see how this is going to work best for people like you who are tuning in and wanting to pick up some information about, just things that they might be able to learn a little bit more about. So stick with us, bear with us. We're just trying to figure this out so that we can best serve you and others who are out there wanting to learn a little bit more and take this information in. So keep an eye on our social media pages. You can always reach out to me directly as well if you have questions about it, but I'm hoping that way we can just reach a little bit more people and get some more good information out there. So with that, let's dive in. Okay, so today we are going to talk about carpal tunnel and or like wrist pain and dysfunction. A lot of people call that carpal tunnel. So why do I want to talk about this? So this is the reason I want to talk about this is because it affects so many people. And why is that? Well, we're doing the texting on our cell phones and the typing on our computers and a million other things because this is life. But times have kind of changed to where we are using our hands and our bodies in a little bit different way than we have, not a little, sorry, a lot different way than we have in the past. And it's time to start adapting. And wrist pain and dysfunction ails a lot of people. But the problem is we don't know what to do about it. Nobody ever tells you what to do when you have wrist pain and dysfunction. And that leaves us with very few options. And the options that we do have tend to not be very good options. So that's why I'm here. I'm here to help you understand wrist pain, wrist dysfunction, and give you some tools for what to do about it if you do get wrist pain and how we might be able to prevent wrist pain. This is important because there just aren't great options out there, well, that we know of. So I'm here to share some great options with you. So Okay, again, why do I do these webinars? And they're going to be switched into shorter videos, and those will be available on our social media pages. I'll share them on my personal pages as well so that people have access to those. Why do I do this? Because I want to get information out there. I am sick and tired of people telling me horror stories about things that have happened to them because nobody ever told them about chiropractic care. Nobody ever told them different things that could be done that they could do to take care of themselves and avoid, unfortunately, healthcare models where we're at with that. And it is what it is. I'm not here to hate on anybody, but the reality is that the medical model doesn't do great for most things. So, and carpal tunnel syndrome is no exception to that. We're going to get into that. So let's dive in. First, I want to talk about how the wrist actually functions. Okay, what most people don't realize about wrist function is there are actually 8 different bones in the wrist, and each one of those is supposed to move independently of the other bones. All of those little 8 bones, and they're little small little bones that are all fit together in 2 rows. So we have a proximal row and a distal row. Proximal means closer. Oh, sorry, I did that backwards. A proximal row and a distal row. Proximal means closer to the body. Distal means farther away from the body. But ultimately, that means we have 2 rows of 8 little bones total, 4 in each row. So both of those, the individual bones and the rows of bones, need to move independently. Like when we move our wrist in different directions, we need the rows of bones to roll on top of each other. We need the individual bones to move properly so that we can have a normal range of motion, a proper range of motion. So all of those bones are supposed to move. What happens is they get jammed. They don't move properly. We lose our range of motion. We maybe can't extend super far. We can't flex super far. We lose our range of motion and we find ourselves in a lot of pain. So pain tells us that something isn't functioning right. With that, inflammation builds up when things don't move properly. This is a concept that applies to the whole body. When things don't move properly, inflammation starts to build up. Inflammation aggravates everything. It aggravates the pain that's already there. So no, and then the real problem is no one tells us what to do about it. We don't have good options. So first I want to talk about why we get wrist pain. Why do these bones lock up? How does this happen? Well, for one, just like I said before, a lot of us sit at a desk for 8 hours a day, and we sit with our hands like this and we type, 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 or we hold our mouse in a certain way and we move our mouse around. So I have a mouse right here. So do you see how my hand is clenched, is kind of like arched forward like that when I hold my mouse? Well, that's a really compromised position for my wrist to be in, but I don't think about that because I'm just moving numbers on my spreadsheet or whatever my job might be. So we do a lot more computer work and we put our hands and our wrist in positions that aren't super conducive for the health of our hands and wrists, but we don't really realize it because we get going in the task at hand. So in addition to that, our texting. So texting is how we do most of our communication these days. And we hold our phone in a certain way. So our wrists are angled just a little bit and we're texting. And don't even get me started on we look down and we text like this. There's a lot that happens in the neck when that happens. So if you have kids who are like teenagers and they think it's cool to like tuck their chin under like that, you do whatever it takes to get them to stop doing that. What I will just share with you briefly, since we're talking about it, I take x-rays in my office, in my chiropractic office in Colorado Springs, and I start x-raying at about 14, 15 years old, and I am already seeing reverse cervical curves. So our necks are supposed to have like a backward C, a nice big backward C curve, and then our head sits on the top of it. what I see a lot of is straight necks like this instead of backward C like that, which this is what's healthy. This is not healthy. And then what I'm even seeing in our young kids, 14, 15 years old, those are babies. They should have perfect structural health. And not even am I seeing straight, but I'm actually seeing it start to curve the other way. So instead of being a backward C, it's going to a forward C just a little bit. That is incredibly dangerous. You guys, we have not had a generation that has always only known technology in their lifetime. They exist right now. It's that age group, and they are growing up, and I am telling you, it's not going to be pretty as they age, because we have all seen elderly people who have lots of arthritis, lots of degeneration. They may be hunched forward. They may not be able to look up. They might keep their head down. They start to cave forward. That's going to be the least of our worries with this generation. If they're already having a reverse cervical curve at 14 and 15 years old, it's serious what's going to be happening to them. So yeah, I try to tell my parents, I try to tell everybody that I can, we have got to get our kids to stop treating their bodies like that. And they don't feel it. That doesn't hurt their neck. It probably hurts your neck and my neck to sit down and text like that for 2 hours. I wouldn't be able to do it, but we have to get them to change those habits, because this is going to create long-term issues for them. So anyways, I digress. I'm getting off topic, but please know that that is an important thing for our youth today. Moving on, another thing that happens is we have this thing called a FOOSH injury, FOOSH. It stands for fall on outstretched hand. Fall on outstretched hand injury. That means you trip and you put your hand out like this to catch yourself, or you trip backwards and you put your hand behind you like that to catch yourself. And then that's how you land. That's instinct, right? That just happens. You just do it without even thinking. Well, when you land with your hand in an outstretched position like this, if you are lucky enough not to break your wrist, then you are going to have jammed joints in there. You're going to have wrist dysfunction. You might also get wrist pain and dysfunction with lifting weights, like if you're bench pressing or doing hang cleans, whatever it is that you might be doing at the gym, even push-ups, that could put some stress on your wrists, and it could cause those wrists to start locking up a little bit. So and this is just life. Like maybe you were rearranging your cabinets, or maybe you carried a super heavy casserole over to the dinner table, whatever. I mean, this could happen. Maybe you're gardening, maybe you're any of these things. This is life. We do things every day. So definitely this stuff could be contributing to wrist pain and dysfunction. Now, a lot of people call wrist pain and dysfunction carpal tunnel or carpal tunnel syndrome. So let's talk about what carpal tunnel actually is. The reason people call it carpal tunnel is because in the front part of our wrist here, this is the carpal tunnel of our body here. So what happens is there is a retinaculum that goes across the front part of the wrist here, okay? A retinaculum is a band of soft tissue. So it goes across the anterior part of the wrist, or the palm side part of the wrist like this, and then neurovasculature, so that's our blood vessels and our nerves, run underneath that retinaculum, okay? So on the front part of the wrist, retinaculum like this, and then the nerves and the blood vessels run underneath that. So that is our carpal tunnel. That's what that's called. So carpal tunnel syndrome is irritation to that whole complex. So when the bones of the wrist aren't moving properly, like I said, inflammation starts to build up. Well, when inflammation builds up, it puts pressure on the nerves and blood vessels there, and it can become very painful. If you have ever suffered from carpal tunnel syndrome or wrist pain and dysfunction, you will understand that it's very uncomfortable. It's unpleasant. So let's, yeah, this actually affects a lot of people. This affects a lot of people, and the problem with it is people don't want to do something dramatic like carpal tunnel surgery. We're going to talk more about that in a minute. but they don't know what to do. So they might just avoid doing things that they love doing. It might affect their ability to do their job. These are serious issues that we need better tools to be able to address. So when you do have wrist pain and dysfunction, you might find yourself going to your medical doctor, and you will find yourself disappointed with that visit because it'll cost an arm and a leg, but it'll also, what you'll get from that is, we can't do anything for that. Or you'll get, here, take this pain medicine or whatever they give you. Here's an injection. Here, let's give you an injection to reduce the inflammation. That sounds great, right? Because we know there's inflammation built up in there. The problem is, we didn't fix the reason the inflammation is there. Do you guys remember? Why is the inflammation there to begin with? Remember, those bones, they get locked up. They're not moving properly, and then inflammation sets in. That happens everywhere in the body. When joints don't move properly, inflammation sets in. So what the medical doctors want to do is they say, let's give you a steroid injection to reduce the inflammation in there. Well, that sounds all fine and great, except for what happens when the steroid injection wears off and your inflammation builds right back up, because we didn't do anything to fix the real problem, which is the fact that the bones aren't moving properly. So, something to think about. In addition to that, if you haven't done research on it, please understand that these cortisone injections that are perfectly safe are not perfectly safe, and they come with very serious side effects and ramifications, and a lot of times they don't even work, and they don't work because we didn't fix the real problem. So that's the problem with the medical approach to carpal tunnel symptoms. They either can't do anything, or they do something that either doesn't help or it pretends to help, and then it still the underlying problem is there. So let me talk to you about carpal tunnel surgery, because I think that you should know, and I don't think that people are properly informed about how carpal tunnel surgery works. So remember how we have the carpal tunnel here, where the nerves and the blood supply runs through, and the retinaculum over the top of all of that too. And then underneath all of that are the bones that are stuck, which is the real problem. So, but the pain comes from the bones not moving properly, and then the neurovasculature being compressed because of that inflammation. So if you don't know what carpal tunnel surgery is the retinaculum that sits right here, the surgeon will go in and they will cut the retinaculum. They'll cut it and relieve that pressure. I don't know about you, but I don't think God messed up when he put that retinaculum there. And I don't think we have any business going around just cutting it open for no reason. What they don't tell you about the surgery is that creates a lot of dysfunction and instability down the road. So if we have a retinaculum that's there for a reason, and then we just cut it open like it's not there for a reason, can you see how that's going to lead to problems down the road? That's not a good fix, and it creates other issues in the process. So don't get carpal tunnel surgery, and don't let somebody you love get carpal tunnel surgery. The really, for one, that's cutting you open. So there's anesthesia, there's all the stuff that's dangerous. And number two, there's recovery from all of that. But the problem is, sometimes, a lot of times, you do the surgery, you recover from the surgery, and still we have pain and irritation in that spot because we still didn't get the bones moving properly. So I hope I've made my point that what you really need is to get the bones moving properly. That's going to play a big role in reducing the inflammation, and by effect, taking that pressure off of the nerves and the arteries that run through the carpal tunnel. So if you are having wrist pain, what do you do? Okay, I have tips for you, so don't worry. I just had a little pop up. I have tips for you. So first and foremost, if you are working on a computer, you have got to get a good setup. You need a good workplace setup. You need a good area. Your computer screen needs to be at the right height, all of that stuff. That is important, especially if that's what you do for a living. Number two, you have to take breaks. You need to set your computer up in a way that your wrists are supported. But number two, you cannot work for 3 hours straight just typing away. You have to take breaks. So, oops, sorry, I forgot to silence my phone. I don't know where my phone is. You've got to take breaks in order to relieve that, that tension that builds up when you're typing like that. So take breaks, get a good proper setup. Yeah, that's what I'll say about that for right now. Number two is you have to have wrist mobility. So first and foremost, you can do wrist stretches. So what I mean by wrist stretches is I want you to work on extension where your wrist goes back this way, like that. I want you to work on flexion where your wrist goes forward, like that. I prefer to do this on the floor. You can do exactly what I'm doing here, just like that. You could do hands together. You could do angle your hands down. You could do the outside of your hands together. You can do any version of this. I actually like to do it on the floor, and I will do another video that shows you how I stretch my wrist every single day. And I have to stretch my wrist every single day because if you don't know what a chiropractor does, I have my hands in extension all day, every day. And I use my hands for my living, and I cannot do my job and I cannot serve my community if my wrists are not functioning properly. So it is important to keep your wrists healthy. So you want to do extension, you want to do flexion, you want to do mobility, wrist circles both ways. You want movement in your wrist, and that should be a daily habit, twice a day if you're really on top of it. I would take a couple minutes in the morning and a couple minutes in the evening to do this. Number two, you have got to start getting your wrists adjusted. I am a chiropractor. I talk about chiropractic. It is important. First and foremost, with chiropractic care, you want to start, your chiropractor will want to start in your neck. The joints in your neck, it houses the nerve roots that come out and go down your shoulder, down your arm, and to your wrist, okay? So we need to address the problem where it might be starting, okay? So we're not going to take anything for granted. We're not going to pretend like nothing's going on in the neck. There likely is something going on in the neck. So first and foremost, we need to get movement in the cervical spine. That's our neck. So once we get proper movement in the cervical spine, we know that there's no roadblocks, no interference that are coming, that are affecting those nerves that go down the arm coming from up here. But don't stop there. We also need to look at the bones of the wrist. Do you remember how many bones in the wrist there are? 8. They should all be moving independently and freely with no restrictions. So when my patients come in, I can adjust every single one of those bones independently, separately, on its own, not just one giant wrist adjustment. These are specific intentional adjustments that affect each bone in the wrist, and they're adjusted differently, truly. So if your chiropractor should not be doing a little mobility in your wrist. That is a cop out, and that is not what your wrists need. You need specific, intentional, high quality adjustments for each of the bones in your wrist. That is very important. This isn't, and do your mobility, do your wrist mobility, but please don't think that that's the same thing as a chiropractic adjustment in your wrist. So like I said, I can adjust each one of those bones independently. If your chiropractor cannot do that for you, please have them reach out to me. I teach this. I want to help them support you to their best ability. So, and if you're in Colorado Springs, I'm your girl. Come see me. I can help you with this wrist pain and dysfunction. We can avoid carpal tunnel surgery and life will be good. So, what have we covered? Okay, so if you don't have wrist pain and dysfunction right now, start this now. There is absolutely no reason to wait until you get wrist pain to start doing these things to improve your wrist mobility, wrist function overall. So do what we've talked about. What we've talked about so far is stretch, get a good workplace set up, take breaks, and stretch, do flexion, extension, circles both ways, wrist mobility, and get your wrist properly adjusted. It's very important. And that can prevent any carpal tunnel syndrome, carpal tunnel symptoms from coming up in the future. That's really the best way to handle these things. That's the best way to handle anything, is to prevent it. So not only do I want you doing these things to address the wrist pain that has already happened or the wrist pain that we're trying to prevent. It's also doing these things is also going to set you up for success in the future and make sure that everything is functioning properly so that you stay healthy. That's really the goal. I don't know how we got turned around in our culture and our society, but there's no reason to get sick and then start doing something about it. There's every reason to take care of ourselves so that we don't get sick. So let's do that. Okay, so we have covered wrist structure and function, why wrist function is so important. We use our hands for everything, We need our hands. So we need them to work and we need them to not be in pain. Why do we get wrist pain? What do we do about it when we get wrist pain? And then how do we prevent it from happening altogether? That is what I have for you on carpal tunnel. I hope this was enlightening. I hope that you walk away with a better understanding of why this happens, how it happens, what's actually happening, and what to do about it, and why you shouldn't have carpal tunnel surgery. And I feel that way about a lot of surgeries. We could talk about bunions, but we won't. So anyways, there's not good reasons for carpal tunnel surgery. And when you're in that situation, you think that there is a good reason, and it's your pain. It's your pain level. That's your reason. You're like, I just can't do this. I have to do something. I guess I'll have carpal tunnel surgery. And that is not a good option. So if you know somebody who is struggling with this, please have them reach out. Get under chiropractic care, start doing wrist mobility exercises. This is a game changer, and it's going to do so much better for you than a surgery where you cut a retinaculum that is actually supposed to be there. So if you have any questions, put them in the chat, reach out to me directly. Remember, we are not doing webinars in this format anymore. I'm still going to be releasing topics and information, but you'll need to follow us on social media to keep up with those. So that is, again, on Facebook, High Altitude Chiropractic, on Instagram at High Altitude Chiro _CS for Colorado Springs. So that is where you can find us. If you have questions, you can message me directly on those platforms, but keep an eye out on those areas for what's going to be happening next, how we're going to be doing this. I'm hoping that it's more conducive for taking the information in for you. I don't know if I will have it ready to go next week. I will try, but I've been doing some research on how to best set it up. So bear with me a little bit. I'm always here if you need anything in the meantime, but I will keep you posted on the social media thing for moving forward with any of this. I want to thank you for taking some time today to better understand wrist injuries, wrist dysfunction, and what to do about it. I think that this information can really help people. So if you have any questions, as always, please reach out. Otherwise, I look forward to seeing you at our next event. I don't know exactly when that'll be or what it'll look like, but you will find it on our social media. So otherwise, keep those wrists moving, safe and healthy. Mobility is a good thing for the wrists and for everywhere else in the body. So if there's ever anything I can do to support you, don't hesitate to reach out. Otherwise, please go have a wonderful evening or rest of your day, and I will see you next time. Bye, guys.